Good morning, everyone. Happy Monday. Look at my Monday, how it's going so far. Traffic. Monday traffic. So, being that I'm stuck in traffic, why not go ahead and talk about sleep apnea? Because traffic is boring, makes people tired, makes people with sleep apnea even more tired. So sleep apnea is the #1 cause of car accidents. Daytime sleepiness, people not sleeping well at night, choking in their sleep. This is a problem. So here I am stuck in traffic. God only knows how many people around me are falling asleep because of sleep apnea. So sleep apnea, just to remind you, is a complete closure of the airway or partial closure of the airway for 10 seconds or more where oxygen levels are affected. When I say oxygen levels, I mean you are oxygen deprived, starvation. Imagine letting all your air out. I want you to breathe all your air out. And on that exhale, you hold your breath. And that's what happens with sleep apnea. You exhale, the airway collapses, just like a fire hose collapses when the fireman turns that water off. That hose collapses. Your airway collapses. It clamps down shut, and you can't breathe. Now, if this was me, and I'm thankful I don't have sleep apnea, but if this was me, I would be very concerned for my life. Sleep apnea kills people. Carrie Fisher, Princess Leia, Star Wars. You all know her. She was amazing, beautiful woman, world famous for her role in Star Wars. What killed her? Sleep apnea. Now people will say, yeah, it said that she took drugs and she took a lot of narcotics and that's what killed her. And the answer is no, that's not what killed her. The drugs only made her more tired, made her airway more susceptible to collapse. And when it collapses, you can't breathe. Imagine not having oxygen for 10 seconds or more over and over and over again. And on some people who are severe, this happens sometimes 100 times, could be even more. I had a patient just recently who stopped breathing 63 times an hour. 63 times an hour of not breathing 10 seconds or more. Now, you don't have to be a genius to figure out what that does to your body. Your brain, it needs oxygen. Your heart, it needs oxygen. Your toes need oxygen. Everything in your body needs oxygen. So if you're not getting that oxygen, the effects that it is having on your systemically on your body, is huge. And this leads to a multitude of diseases. And here on Dr. Sleep with a Smile, we're going to get into each one specifically. Today, I just want to give you a general synopsis of just some of the things that can be affected with sleep apnea while I'm stuck in traffic here on this, again, beautiful Monday morning in Miami. Traffic, all around me. Traffic, well, you can't really see behind me, but traffic. So, sleep apnea has directly been linked to diabetes, high blood pressure, cardiac disease, dementia, erectile dysfunction. For you men out there, and actually for you ladies out there, I'm sure you're very concerned. This is a problem. This is actually killing people. So the first line of defense against sleep apnea is a CPAP machine. I'm sure most people are aware of it, and I hate to get back into Star Wars again, but if you know Darth Vader, which most people do, that machine is strapped to your face, kind of like Darth Vader, shooting positive airway pressure down your nose, blasting open that airway, and allowing you to breathe. And this is a wonderful thing. It's the gold standard of treatment. The problem is, not everybody can wear it. When I say not everyone, I say millions of people that do not wear the CPAP. There's also millions of people that wear it, and that's wonderful. We're not trying to get anybody off the CPAP. That is not our goal. But there are millions of people that don't wear it. And if you're not wearing your CPAP, guess what's happening? You're choking. You're choking for at least 10 seconds. Many times, over and over again throughout the night. So there's mild, moderate, and severe sleep apnea. Mild occurs if you choke from about 5 times an hour, okay? 5 to 15 times an hour, we'll say. Moderate is from 15 to 29 times an hour. 15 to 29 times an hour of choking in your sleep, and you're not even realizing it's happening. And then there's severe, which is 30 or more times an hour of choking in your sleep. A pause in breathing. This is a problem. This affects the whole entire body, and we are here to help anyone who does not use the CPAP. So what we offer is alternative CPAP therapy for non-compliant CPAP patients. We use airway metrics. We use the pharyngometer, and with the pharyngometer, we're able to map out the airway to figure out where to set what's called an oral appliance. An oral appliance is a mouthpiece that we use to reposition the mandible or lower jaw in a comfortable position where we allow the tongue and other muscular structures to be brought forward, as well as stabilizing the airway so you can breathe while you sleep to bring down these apnea events. The patient I mentioned earlier that I was choking around 63 or 65 times an hour, this is a severe patient who could not tolerate a CPAP, won't wear it, tried it, he could not stand it, he would rip it off his face. He was choking in his sleep repeatedly, waking up with acid in his mouth, literally choking on acid in the middle of the night, waking up. So 4 months into the case, we've gotten him down now from 65 times an hour of not breathing on average down to 10. 10 times from 65, and this is a severe patient. Severe patients, we strive to get at least 50% better. That's our goal. 50% better, even 25% better is better than zero by not using the CPAP or not using anything at all. Mild to moderate cases, the oral appliance works wonderful. The American Academy of Dental Sleep Medicine has actually published and approved oral appliances as a first-line defense against sleep apnea, along with the CPAP. This is huge. So we're here to give you this information. We're here to help out these patients, any of you patients, any of your friends, any of your family, your loved ones, to sleep better, to feel better, to start getting you breathing properly so you can get into that deep sleep that you're not getting. Sleep apnea affects deep sleep. It affects your REM sleep. A lot of people don't have dreams, and they don't have those dreams because they have sleep apnea. So the traffic is now clearing up, everybody. I appreciate you giving me your time. This actually helped me get through my time, and we made it. The traffic is clearing up. Let's help you with that sleep apnea clear up. Thanks for listening in. I'm out. Please call us anytime, 954-981-5600. Dr. Sleep with a Smile, drsleepwithasmile.com, or you can email us at sleepwithasmile@gmail.com. We'll be happy to help you in any way we can. We offer free airway screenings. Please check us out. Have a good day. See you on the next channel news.